diastasis recti and prolapse. This is about healing and educating these relatively common conditions and supporting our women to stay safe and supported in our classes, and making sure that we don't actually do any harm. So diastasis recti is a separation and widening of the gap between the left and right side of the rectus abdominis muscle. So this muscle is often called the six-pack muscle. It looks a little bit like a six-pack, and I'll show you in the diagram in the next slide the visual on this one. It's really common, this condition, in newborns and in pregnant women, because obviously during pregnancy there's a lot of tension on the abdominal wall and the muscles separate, creating an issue with stability and alignment. You can also sometimes hear this condition referred to as divarication of the recti or rectus divarification, and often it's women who have had multiple births and multiple pregnancies, women who have had this condition in previous pregnancies. Really tiny, petite women will often be at higher risk for this condition. Women with poor abdominal muscle tone, and sometimes women who have got that inward facing curve of the lower back increased, which is also known as hyperlordosis, will tip the uterus towards the front wall of the abdomen, and that will also increase the strain on the abdominis, the rectus abdominis muscle. So this condition has a ridge-like experience. It can actually stretch from the lowest part of the breastbone all the way to the belly button, and it can also be quite wide in when we measure it in finger widths, as we usually do. So the split occurs at the abdominal raphe or linea alba and the linea semilunaris. These are collagen structures in the midline at the front of the abdomen, and it's literally a little bit like splitting a seam open, as you can see in this diagram. So the linea alba is usually quite a thin line of fascia or connective tissue or collagen. And in the diastasis recti, that is actually separated. So it's not the muscle fibers, which are in red here or orange here, that are torn. It's actually the fascia that joins those muscle fibers in the center that actually separate. All four abdominal muscles actually meet in the midline. So you've got your transverse abdominis, the internal and external obliques, as well as rectus abdominis, that are all joining here at this seam. And we covered those muscles in our pelvic floor anatomy lecture. The separation results in a lack of protection for the abdominal cavity, and it also, that protection extends to the lower back. So if we don't have integrity and we don't start to correct a diastasis recti, then it can actually start to impact with lower back pain, with pelvic floor dysfunction and other issues. So the impacts are also aesthetic. So some women notice that there's a bulge in the area and they don't enjoy having this aesthetic, and for many women it's a functional issue. So 66% of women who have this condition also have some level of pelvic floor dysfunction. So these two conditions are connected. And so it does figure that when we start to correct a diastasis recti, we can start to also correct any kind of pelvic floor dysfunction along with it. It can be related to back pain and what people also call a weak core, where they find it difficult to engage the core for something like a sit-up or a any kind of high core experiencing posture like Navasana, boat pose, for example. And it's quite often related to misalignments in the pelvis as well. So a lot of intra-abdominal pressure, which is associated with the increasing size of the uterus, causes this widening, which can also then be linked to hernias and prolapse. And we'll be covering prolapse in a little more detail. Addressing your pelvic alignment, working on the core muscles consciously without overdoing intra-abdominal pressure, and the muscles will then start sealing themselves back together. Now, I emphasize that word consciously with the core muscles because quite often in both pre and postnatal yoga classes, there is a tendency towards working on strengthening muscles before the body is ready to strengthen them. So I'm going to explain more about what I mean as we progress to the section on prolapse, because it is tempting to want to guide and facilitate a return to a former level of strength postpartum. That's a very natural tendency for women. They might want to re-engage with abdominal crunches and doing lots of core strengthening work. But the truth is, and the reality is, that due to the changes of hormones and then due to the structural changes that might have occurred with diastasisrecti, for example, we must be more conservative and not expect the same return to strength within 12 months postpartum, because those influences are going to be there no matter how hard we work, and we may even increase those influences and dysfunctions if we overdo things. So I very much encourage teachers and students to err on the side of conservative and to go for practices that are more gentle, breathing orientated practices before starting the more hard core exercises that we will often see especially in a gym setting, a Pilates setting, and even some postnatal settings. So to check for diastasis recti, there is actually a good diagram here. We would lie on the back, and we can check our own, or we could ask someone else to actually do the test for us. And we would lie in the crook lying position with the knees bent and the feet flat. And the head and shoulders stay relaxed initially, placing the fingers with the palm facing towards you just above the belly button, so between the sternum and the belly button. And when you lift the head and neck very slightly off the floor and press down into that area just above the belly button, if you feel a gap there, that's your diastasis. And as you lift the head and the neck, but not the shoulders, you may also feel the rectus abdominis muscles closing in around your fingers. But if those muscles are not closing in around your fingers, then it could be that there is a separation. You would also repeat the test with the fingers directly over the belly button, and then 4 to 5 centimeters below the belly button, roughly where Svadhisthana chakra is, if you know that chakra. That gentle contraction as you lift the head and shoulders slightly off the floor should result in this little feeling of resistance in the fingertips, and usually it's less than 1 to 2 finger widths in a mild diastasis. But if it's more than 1 to 2 finger widths, then it could benefit from some work to close the gap. So how would we close the gap? Well, first of all, we would do no harm. So that would mean that we would take a lot of care with strong core movements. We would avoid sit-ups, boat poses, even push-ups and planks will put a lot of strain on the transverse abdominis, which is your deepest abdominal muscle, and it will also start to impair and separate the fibers of that rectus abdominis also. So even double leg lifts in lying can put a lot of strain on the muscle to make it worse. We would avoid any kind of constipation and heavy lifting, which is really quite difficult postpartum if you're doing lots of washing. Your baby might be a heavy baby. We need to be really, really mindful of the way that we lift. We do need to also make sure that we've diagnosed the condition correctly, because there is a difference between having a diastasis recti and having an actual hernia. So the hernia is where the abdominal contents start to actually leak out, either close to the umbilicus or belly button, or sometimes even into the groin. And these do need surgical repair. So if in doubt, I would always get that diagnosis absolutely correct with an ultrasound. Some diastasis recti will just resolve on their own, but there are lots and lots of different systems out there that you can use to resolve diastasis recti. So Julie Tupler created a system called Lose Your Mummy Tummy, and the Mutu system is also very much focused on recovering the diastasis recti. So the next condition is identifying the pelvic organ prolapse, or POP. So POP, or POP, is characterized by the descent of any of the pelvic organs inside the vagina or beyond the vaginal entrance, and it really impacts a woman's quality of life. However, some women may have a small prolapse without realizing that it's started, and some women have even reported that they were placed in a squat position or a wide-legged position inside a pre- or postnatal yoga class, and that they spontaneously actually prolapsed to the fullest extent, which means that the pelvic organs actually were beyond the vaginal entrance. And this is a really common condition which affects up to 50% of childbearing women, whereas prolapse symptoms are only reported by 21%. What that's saying is that a lot of women may have some degree of prolapse, but not so many symptoms, and it may go overlooked for some time until it starts developing to a higher level or grade. It is the most common reason for hysterectomies in the US after cancer, especially for menopausal women, because if we don't address it in the pre- and postnatal years, it will tend to be something that worsens. Prolapse symptoms are generally a departure from the normal sensation, structure, or function experienced by the woman in reference to the position of her pelvic organs. So the symptoms become worse at times, especially if gravity is impacting the pelvic floor. So after we've been standing for long periods or doing lots of upright exercise, especially exercise that involves heavy bouncing like star jumps and rebounders, etc. But the condition often feels better when gravity has been eliminated. For example, when we've had a lie down first thing in the morning, or legs up the wall for 3 minutes, the prolapse starts to reverse. And gravity has a big impact on this condition. So in a stage 0, there's no prolapse. In a stage 1, the most distal portion of the prolapse is more than a centimetre above the entrance of the vagina, or the level of the hymen. So we can't actually see any visible exit point of the organs. The vagina might look normal from the outside, but if we were to palpate, we may find that there is some evidence of organ prolapse, or towards that 1 centimetre to above the hymen. And this particular condition can occur towards the anterior wall or the front wall of the vagina. It can occur to the posterior wall of the vagina, the back wall of the vagina. And it can also occur in the uterus where the neck of the cervix descends directly down. So it does require usually an internal palpation to determine whether it is in fact the bladder, the uterus, or the rectum that is prolapsing. A stage 2 is where the most distal portion of the prolapse is 1 centimetre or less proximal to or distal to the plane of the hymen. So this is where it's actually starting to possibly become visible from the outside. A stage 3 is where the most distal portion of the prolapse is more than 1 centimetre below the plane of the hymen. So we will be able to see this visibly from the outside. A stage 4 is where the prolapse is more than 1 centimetre below the plane of the hymen. And stage 5 is where there is essentially complete eversion of the total length of the vagina. And this is obviously very distressing for women, and it does require proper intervention. A women's health physiotherapist will know exactly how to support this condition, and it is a really important thing to manage it conservatively, which means that there is no surgical intervention involved until all other measures have been trialled, because there has been a class action against the company that introduced pelvic mesh, which was designed to pin the vaginal wall into place to reduce a prolapse, and this mesh has become the nightmare of many women's lives, and surgery is a pretty drastic measure to take. So identifying POP is basically, usually there is some complaints of a bulge or something coming down through the vaginal opening. And women sometimes say that they can either feel the bulge by palpating it or touching it, or they can see it aided with a mirror. And there's a complaint that there's this increased heaviness or pelvic pressure, a dragging feeling in the perineum and or the pelvis. Sometimes, if the prolapse does descend to the vaginal, outside the vaginal opening, there can be some bleeding and some even infection and ulceration of that very delicate tissue, and this also needs to be addressed. So some women describe in their horror that they've experienced this condition, and I know of 3 women who have come to my Explore and Restore pelvic floor workshops who have very tearfully admitted that it did happen in a yoga class to them, that they needed to run to the ladies' room and then digitally replace the prolapse or apply manual pressure with the fingers to the vagina or perineum or rectally to either assist voiding or defecation or to prevent any further worsening of the condition. A lower backache is really common. It feels a bit like period pain for women to get this dragging feeling into the lower pelvis. And sometimes we can pick up a POP just through other urinary related symptoms. So maybe someone feels like passing urine, but they can't because they feel like there's a mechanical block. Or sometimes the urinary stream is affected by the mechanical nature of this condition. And so it will be a case of getting the diagnosis correct. So prolapse poses to avoid are exactly the same things that we would avoid with diastasis recti. We would avoid boat poses or navasana, where we're having to do both legs lifting and a full abdominal contraction, because quite often with a pose like boat pose, the teacher is not cueing the pelvic floor contraction that is required to make this posture safe. So in a posture like Navasana, for example, where we are engaging the abdominal muscles quite strongly, if we don't engage the pelvic floor muscles along with that, or if we don't cue the body to engage the pelvic floor muscles alongside the abdominals, then the abdominals literally press the abdominal organs against the pelvic floor, and that bearing down sensation and that pressure is enough to create an increase in prolapse. When we're on plank, in a plank position, for example, it requires a lot of strength in the abdominal muscles. So again, if there's a diastasisrecti, this is not advised, but also, if the abdominals are a little bit dysfunctional and they're not supporting the abdominal organs and there's pressure through the abdomen, then we might also find that there's a bearing down into the pelvic floor muscles and again an increase in prolapse. So deep squat poses, I recommend avoiding these, especially for 6 to 12 months postpartum, or even just stop doing them completely. Forward bends with wide legs. So just modifying these because quite often, so this would be something like fan pose or forward bend with V legs, as that's also called. That wide-legged position is basically opening the bony points of the pelvis, and the pelvic floor muscles themselves are opened to a vulnerable state, and then the prolapse is increased. Sometimes even belly locks like Uddiyana Bandha and upper body weight bearing poses will result in a bearing down or a breath holding, and this will increase pressure, intra-abdominal pressure, which increases the strain on a diastasisrecti, and it can also increase pressure on the prolapse. My other pet nemesis is the double leg lift. So this is where we're lying on our backs and we're being instructed to lift both legs 30 degrees off the floor, both at the same time, or 60 degrees off the floor, or even lifting them all the way to 90, which in and of itself in a healthy body is quite a strong activity. But if it is happening in somebody who has a prolapse or a diastasisrecti, or who is postpartum and has some abdominal separation or weakness, or is prenatal, then there is not enough abdominal support to do this particular exercise safely. And what will happen is there will be a bearing down against the pelvic floor, which can result in an increase in prolapse, or there may even be a widening of the diastasisrecti. And it takes a lot of personalized focus to get a double leg lift to be optimized and safe. And so I do recommend that if there is someone who is questioning this, that the alternative is to do it with a single leg, a bent leg, and maybe go into Apanasana, which is knee to chest, rather than a straight-legged leg lift. The thing about a prolapse is that it does respond so well to gravity. So anything that assists the pelvis to turn upside down, to literally be inverted, will result in the organs falling away from the pelvic floor and the pelvic prolapse itself being supported with gravity to actually come back into its more optimized position. Now, the problem with a lot of these images here is that even though the body is upside down, if we haven't got the upper limb strength or the alignment right, the tendency can sometimes be to hold the breath or to bear down against the pelvic floor. So we need to be really mindful that through a lot of heavy upper limb weight bearing, if we're an experienced practitioner, these poses will be fine, and the gravity assistance. I especially love a headstand for the gravity assistance it gives the pelvic floor. But if you're not seasoned at that, then it's not necessarily going to be the best practice, because it may well be quite a strong exertion, and we don't want that bearing down or holding breath. So you would err towards that conservative approach with more restorative inversions, like Setu Bandha or bridge pose, with the pelvis resting on a bolster, blanket or block. Or perhaps you try legs up the wall. Perhaps it's puppy pose, where you're in down dog but on your knees. It could be that reclined Baddha Konasana is the best pose to be in to support a reverse of the prolapse. Or maybe it's Halasana with full bolster and chair support, so that the pelvis can also experience the inversion. I generally recommend 3 minutes to stay in the restorative posture, so that there's enough time for gravity to really impact and draw the vagina back to its optimized position. And I do also recommend checking out some more detail on this condition at tinyurl.com/return to self pelvic floor. This e-course goes into a little more detail, and you can also pick up a free ebook as part of that course, which is the complete guide to the pelvic floor, 7 keys to awakening your inner goddess. Thank you so much for joining me today, and I hope that's been helpful and interesting, and I so look forward to sharing more adventures with you in the future. Namaste.